What to you maybe is misunderstood or little known about poop?
Well, it's hilarious for one thing
Yeah,
that we
it's
do
fun to
it.
say it.
That
Oh, okay.
the word is great as well.
Yes.
There's so many different words. I do, when I'm talking to the parents of pediatric patients, I use the word poop. I don't often when I'm talking to adult patients, try to choose a more mature word. But poop is amazing. I mean, I guess it's sort of the dirtiest, the most vile, the most hated aspect of our bodies. It's the grossest. We don't want to think about it, talk about it, have it anywhere near our, food or in social interactions. With good reason. I mentioned gastrointestinal infections are one of the most common infections the human body suffers from. And, what we call the way they spread from person to person, grossly enough, is referred to as the fecal oral route, which means a bit of someone's stool is getting into you're swallowing it, through the water supply. For instance, diarrhea is actually quite a brilliant mechanism of these microbes, right? Let's say you're in the intestine of one person, your goal is to get into the intestines of another person. Brilliant to just trick their intestines into secreting all this fluid into the intestines to increase the volume of stool and its runniness so that when they do poop, it gets into the water supply and then everyone else kind of ends up getting infected as well.
Wow, that's
It's
brilliant.
genius. Just the same way, like, tuberculosis or coronavirus kind of infects your lungs and makes you cough, and you send it out into the air and it ends up in other people's lungs.
And that's all evolution.
Yeah, it's brilliant. So diarrhea is intelligent, is a big takeaway lesson.
It's one of the most intelligent things we can do as an entirety of an organism, not just the particular cognitive organism, but there's we're made up of bacteria and viruses, and there's a lot of visitors and so on. As the entirety of the system, diarrhea is one of our better accomplishments. It's fascinating. Well, I wonder, why is poop funny?
I think a lot of that is socially constructed, just how it's sort of supposed to be hidden away, yet something we always do, something, we chuckle about as children. But even in healthcare, it becomes this big topic of conversation because you end up talking about it constantly. Like in the ER, people come in, there's complete strangers, sometimes like a nice old lady who resembles my grandmother, and all of a sudden I have to ask her all about what's happening in the bathroom. Like, is she straining? What color is it? What's the consistency? Does it float on top of the water more than it should? Is it hard to flush? I mean, there's a million different questions you learn as a medical student, and you're like this poop detective when people come in with issues. And so it's funny, I guess, in the exam room with the doctor-patient relationship, there's sort of no barriers. You talk about everything, and you're talking about the most intimate details of a person's life, even though you just met them a second ago. It's so different than normal social interactions. Yet there is this social aspect. A lot of what I do is social. It seems like doctors, what they do is mostly scientific, but actually it's just relating to another person, and you have to maintain, your professional demeanor and this normal human level interaction, even though you're talking about poop. And that's a skill, that's an art and a science.